With 11 centres located in northern metropolitan Melbourne, Mary Community Health Services, MCHS, provides services for children, youths, adults, carers, older adults and those with disabilities. From a public health organisation, which focus more so on promoting the health and well-being of the population as a whole, community health organisations aim to improve the health of the community through focusing on the individual. Community health organisations, such as MCHS, deliver primary health care, usually within the community, focusing predominantly on issues affecting that community, and may receive Victorian Government funding for programs and services offered. MCHS is overseen by a board of 9 directors whom are responsible for developing and monitoring policies. All operational responsibilities are delegated to the CEO, who establishes appropriate services and programs, allowing each unit to work effectively and efficiently. MCHS collaborates with 200 organisations, educational institutes and health providers across the state to reach their objectives, including Melbourne Health, the Moreland City Council and LTU. Services are divided into primary care and carer services, family and community support services, and corporate services for all MCHS staff. Programs and services including aims to improve food access to consumption can be found under the first subheading. Run under the Chronic and Coordinated Care Team, services such as diabetes education, dietetics, and short-term education groups provide participants opportunities to learn about healthy eating and lifestyle modification, often accompanied by practical sessions such as label reading classes. MCHS has 11 centres across Victoria where individuals can be referred to or self-refer for services at a centre or home visits and/or phone or email correspondence. All of the centres are also wheelchair accessible. On first point of contact, a service access team is available to help with interpreting services, eligibility, and advice for the services on offer. Additionally, an annual report and quality care report is published, which highlights and details achievements, partnerships, projects, and financial information of the previous 12 months, allowing target achievements to be measured. Through continuous feedback through client satisfaction surveys and feedbacks and complaints allows MCHS to address any gaps in services. Through involving the community in this process, they ensure community expectations can be met. There are also many opportunities for the community involvement through community programs such as leading walking groups for health promotion. Through involving the community, Mary is able to tailor the programs and services to address the expectations or needs of the community find most important, which theoretically should loop back into improved involvement as well as motivation levels, as the issues addressed have been identified by the community as the most relevant to them. Through having these rights met, clients should feel safe and comfortable in going to Mary for their healthcare, increasing their likelihood of attending appointments, programs and sessions. By having their rights met, it's expected that clients would also be more willing to listen, try to understand, and in turn follow advice and recommendations given by the health professional. Through their multitude of programs and services, Mary assists individuals to be physically, socially, and mentally able to access healthy food. However, to do this, financial, cultural, educational, and geographical barriers must first be overcome. Financially, Moreland has a lower CFA than the rest of Melbourne, suggesting a lower socioeconomic status. An inverse relationship between socioeconomic status and vegetable consumption in Australia and several other countries has been found. Additionally, healthcare patients' out-of-pocket costs have increased by half over the last 10 years, presenting a huge barrier to healthcare, especially for those with a lower socioeconomic status. Mary acknowledges this and as a result offers free or subsidised fees to allow individuals access to fair, reasonably priced services. Culturally, the Moreland community is rich in diversity. Over 2/3 of its population born outside of Australia, with 39.4% of all residents speaking a language other than English at home. To accommodate for this, Mary provides brochures and education materials in several languages, as well as offering interpreter services to clients. Almost half of the Moreland community in 2011 held no educational qualification, so Mary has adopted Easy English in all brochures, flyers and posters, as well as altering materials based on feedback from clients around understanding information. Lastly, as so many of the community don't have access to a vehicle during the day, Mary has 11 buildings across the Moreland catchment, as well as home visits and conducting local programs in local landmarks, for example the library. The 8 principles of quality management provide assistance towards continual performance improvement through focusing on objectives, fulfilling customer requirements, and systematic guidance. One way Mary aligned themselves with the 8 elements listed on this slide was adopting the active service model. Implemented under the HACK program, the ASM believes in focusing on individual strengths rather than their deficits, and that each individual has some ability to improve their health and well-being. The ASM focuses on the customer and provides a way for the health professionals and patients to be fully involved in the MDT care plan. It is a managed process that aims to identify, understand, and manage the interrelated plans from each discipline to provide the most effective and efficient care to the patient. Mary fosters continual improvement, as previously discussed, and makes decisions based on analysis of data to be mutually beneficial for both MCHS and the Victorian Government through promoting a healthy lifestyle, which in turn should reduce the burden on the healthcare system. Culturally competent practitioners are able to effectively work with the individual from different cultures and socioeconomic backgrounds and acknowledge and accept the attitudes, experiences, and beliefs of the individual. Cold groups within Australia have found to be a higher risk of type 2 diabetes, cardiovascular disease, and other conditions, and in comparison with the greater Melbourne community, Moreland has higher rates of many of these conditions. Mary recognises these relationships and conducts needs assessments alongside analysing demographic data to plan, implement, and evaluate programs aimed at addressing these identified issues. Mary provides culturally safe and appropriate environments at all sites and conducts a cultural audit to identify and break down barriers, as well as providing Aboriginal and Torres Strait Islander cultural awareness training for all staff. Thank you.